So apart from that, it shows a lot about how we should, I think, disseminate and implement schema therapy. On a more general level, it is also interesting because in the context of a more general debate, whether techniques matter or not. So in the field of psychotherapy, there's a lot of debate whether it's mainly the therapeutic relationship and the techniques don't matter so much. And if you have a nice relationship with your patients, almost everybody will recover. And this study is not in line with that. It really gives evidence that techniques matter. And how well you apply them, just how well you are trained in them, makes a difference.
Yeah, I guess that one of the things to think about with that in terms of techniques and schema therapy is that schema therapy as an approach is especially focused on the therapeutic relationship, the idea of needs, and there's the notion of limited reparenting. So it's a technique that would tend to enhance the therapeutic relationship, we might say. And do you have any thoughts about that in terms of the study and the
yeah, exactly. So in schema therapy, there's quite a lot of techniques, you can call them techniques, that are focused on the therapeutic relationship. So it's a bit artificial to completely distinguish between the therapeutic relationship and the techniques, because in schema therapy there are quite some explicit techniques like empathic confrontation and limited reparenting. And these are among the techniques that novice therapists struggle with. So it's very important that they get a good training in using that, and not do it in a sort of in a way which is not helpful for patients. And because it's so often it's quite fear arousing initially, because you address the patient in quite a direct and personal way. So I think therapists need to practice that and reach a point where they feel comfortable enough to do that, even with very complicated patients.
Yeah, and that this would be both with the empathic confrontation and the limited reparenting, all the whole range of things. Yeah,
exactly.
Yeah.
Exactly. Yeah.
One of the questions that came to mind is with the outcome between the different therapeutic approaches and the training. Were there equivalent levels of training with both approaches, or how much would be attributed to advances in training?
You mean between treatment as usual and schema therapy?
Well, there's the client-centered approach. So the
client-centered
so I guess all of those three in terms of the levels of training and how much would we say that we had more advanced training in schema therapy.
Yeah. So the therapists that were in the client-centered condition, they received a similar training as the schema therapy therapists. So a 4 days workshop and every year central supervision. So that was equivalent. The treatment as usual therapists didn't receive a specific training because they were supposed to apply what they usually do with these kind of patients. But we investigated their level of expertise with the treatment they applied, and it's much higher in treatment as usual. So the treatment as usual therapists reported to have very extended experience and training in the things they did with the patients in the study. Whereas the schema therapist and the client-centered therapist felt that they were very novice and not well trained. So apart from the training for the study. So it was really a new method for them, and both complained a little bit that it was difficult to do it. So they felt that if they had applied it more often, they would have done better.
Yeah. So now the confidence in these with the client-centered and the schema therapy was in relation to practicing that technique, so that they and it's interesting. So the treatment as usual therapists were more confident than the other groups, but less effective.
Yeah, and So in this sense, it was not a classical efficacy trial where you train therapists and let them do 2 or 5 cases under supervision and only allow them to go in the final trial if they prove to do it well enough. It's more sort of implementation trial where you give a sort of training and a little bit of supervision. You say, okay, this is it, try it out.
Yeah.
Which make the results better generalizable to real practice.
Interesting. Yeah.
So this tells us something. What are the effects if you train a therapist in a specific way, and they go to their clinic and they apply it to patients.
Yeah.
So that's very very nice to see that chemotherapy has such nice effects, despite that therapists felt that they could need more training, more supervision, more confidence.
Right. Yeah. Well, that would be interesting to see when you do a study, a follow-up when the therapists are feeling confident, and how that goes. Yeah.
That would be very nice to do a real efficacy trial, but we don't have the money to do that. It's very costly.